We're very lucky to have Dr. dal Bello here from Santiago, Chile.
It's so difficult be here because, like as Dr. Blum said, my first language is Italian because my father is Italian, my mother is Brazilian, and in the last 5 years I'm living in Santiago, Chile, that speaks Spanish. So 3 languages, and English never was my main language. So I will try and I will do my best. Sorry for some mistakes. I will present our study that we developed it on 2008. The influence of the, have you the here, sorry. There it is. Thank you. And the influence of the chiropractic treatment in patients with insulin resistance associated with diabetes type 2, a case series. So, the introduction, a fast introduction, diabetes is characterized by the increased blood sugar levels that results of absolute or relative damage of the secretion of insulin and or in the action of the insulin in result of the combination of insulin resistance and dysfunction of the pancreas beta cells. Some things you talk more about, but some things is so easy to understand from you here in the United States, where chiropractic is so common and so popular. But in South America it's so difficult to people understand that in chiropractic treatment, and I will talk about a little more after. The production of the insulin occurs in the endocrine pancreas and is regulated by metabolic, hormonal, and neuro factors, being this last one carried thought for the autonomic nervous system. So, like example, we have a circle that started with some alterations in metabolic, hormonal, and neuro factors that occurs increase of the blood sugar levels, and we have a diagnosis of diabetes. We have increase of insulin secretion. We have insulin secretion alteration and increase of the levels of insulin in the blood, insulin resistance, and dysfunction of the pancreas cells, and we start another time with the circle of the pathology. For that, we was think in 2008, what can we do like chiropractic to help these patients? Why this question appears? Because you can understand that chiropractic started in Brazil in 2000. We are the first generation of a full university chiropractic program in Brazil, and we was graduated at 2004. So this study was developed in 2008. When I start my clinician after 2004, when I was graduated, some people called to the office, asked about a visit, and arrived in the office asking about if I can read their hands to look their future, because they was thinking that I was chiro hands, I can read the lines of the hand, and talking about his or their future. So the people in Brazil don't actually understand, the major people don't understand what is chiropractic and what do a chiropractor. So in Brazil, actually, we have 800 chiropractors, not for 220 million people. And in Chile, we are like 80 chiropractors, not more. So in Brazil, we have only 2 universities with a chiropractic program. For that, we was thinking what we can do for these patients to help them. Chiropractic treatment, but we were working in only lumbar pain and cervical pain, normal things that a chiropractic start and the people understand. So what do a chiropractic with a patient with diabetes or insulin resistance? For that, we started work with some medical doctors to their help in this study, and one of them started like a patient in chiropractic. So he didn't believe in chiropractic, and he had some pain in the lumbar region and cervical region. He started to him treatment on chiropractic, and feels better very fast, and start to say of him patients to go to the chiropractor. Was the first time when you work with a medical doctor. So we developed this study. Was the objective was to analyze the influence of the chiropractic treatment in the insulin resistance in diabetes patients type 2. What were the methods? We received from the medical doctor 4 patients with diagnosis of diabetes type 2 that was doing the same medical treatment and the same nutritional control, factor so important to that. And the treatment consisted of 8 office visits that incorporated chiropractic adjustments to the spine and chiropractic manipulative reflex techniques, CMRT, to balance visceral somatic and somatovisceral reflexes for the pancreas. The medical doctor realized with a laboratory the blood tests that were taken on the 2nd and the 8th office visits before and after the chiropractic treatment. The laboratory analysis sought to determine fasting insulin and blood sugar levels, and resistance was calculated using the homeostatic model assessment, the HOMA-IR index, published in 1985. So the results were this one. In the 2nd chiropractic treatment visit, the index before the chiro treatment of the resistance of insulin was 563. It's so common when this result is more than 5, is normal, is a confirmation of the insulin resistance and the diabetes. Until 3, we have an acceptable value, and under of that is like similar of normal. So before the 2nd chiropractic treatment, the average was 563, and after this visit was 561. I know that statistical evaluation is so poor with 4 patients, but we try to do some things to evaluate our work. I know that it's so difficult to publish in some results with 4 patients a case study with this statistical evaluation, but we try to do for look the alteration. In the end of the treatment, 80 visits, the average was 375, and after the chiropractic treatment 405, with no significant results in statistical evaluation. But here we finished the treatment. We have not significant results in statistical, but we can look some alterations in level of the insulin resistance that decrease next to the normal results after the chiropractic treatment. So for that, we decided follow the treatment for more 3 weeks. And we found after 2 months and a half, 3 months, a significant result comparing the final treatment with the initial treatment. Some discussion that studies have demonstrated the relation between the chiropractic treatment and the influence on the visceral functions in diverse pathologies. Such a relation can be explained by the removal of the complex of vertebral subluxation, through which it occurs improvement and restoration of the function of the autonomic nervous system, modifying the visceral function and also the metabolic functions, including conditions such as diabetes type 2. Conclusion: chiropractic treatment can reduce insulin alterations in patients with diabetes, but we know that is a very simple and initial study. We know that we use only 4 subjects, and we know that we need work in new studies in the area to demonstrate significant results in the futures. But for us in South America, in 2008 was our first step to show the chiropractic profession results in South America in visceral and different symptoms and signs and pathologies, comparing the lumbar pain, cervical pain that was normally treated. For that, we started in 2008 to work with SOT technique, and until now we work in like 12 or 14 studies using SOT with different pathologies or clinical problems. Was a first step, and for that some medical doctors and PTs and other professionals start believe us like chiropractic, because it's so different or practice chiropractic in South America comparing North America that is when born the profession here. So for that, sorry for my mistakes. I hope that you can understand me, and thank you so much for the invitation. It's a pleasure to be here. Thank you. Thank you. Chiropractic treatment in patients with insulin resistance associated with diabetes type 2, a case series. So, the introduction, a fast introduction, diabetes is characterized by the increased blood sugar levels. Dr. Blum said, my first language is Italian because my father is Italian, my mother is Brazilian, and in the last 5 years I'm living in Santiago, Chile, that speaks Spanish. So 3 languages, and English never was my main language. So I will try and I will do my best. Sorry for some mistakes. I will present our study that we...
We're very lucky to have Dr. dal Bello here from Santiago, Chile. Okay.
It's so difficult be here because, like, as developed it on 2008, the influence of the here. Sorry. There it is. Thank you. And the influence of the